We're now entering the second week of the government shutdown, and Marjorie Taylor Greene is turning out to be a helpful voice for Democrats in their political standoff with Republicans. So here's what's going on. Democrats say they will not vote to reopen the government unless the legislation includes money to extend enhanced Obamacare subsidies. And the Republican Congresswoman from Georgia actually appears to be on their side, tweeting, "Not a single Republican in leadership talked to us about this or has given us a plan to help Americans deal with their health insurance premiums," which drew this response from Senate Minority Leader Chuck Schumer.
So hold on to your hats. I think this is the first time I said this, but on this issue, Representative Greene said it perfectly. Representative Greene is absolutely right.
Joining me now in the group chat, Catherine Lucy, White House correspondent for Bloomberg News, Charlie Dent, former Republican congressman from Pennsylvania, and Antoine Seawright, Democratic strategist. All right, before I come to this side of the sartorial table, Catherine, I want to talk to you because I hear this argument going two ways. It starts out like, hey, healthcare subsidies, we should extend them. And the Republicans usually say, you actually just want subsidies for illegal migrants. And then it sort of devolves from there. At this point, what's actually going on?
Well, what we're seeing is there is some talk around healthcare now that we weren't seeing maybe a few days ago. I mean, I think most notably this week, the president himself in the Oval Office on Monday, I was in there as part of the press pool, and I asked him about, would he talk to Democrats? Would he talk to Democrats healthcare? And he seemed to say yes. The White House then kind of walked some of those statements.
I was about to say, then Republicans on the Hill were like, what? We are?
Yeah, so it was quite a day. But the White House then said, wait, we want to reopen first. But clearly he was suggesting some openness to this, which I think indicates that they are feeling some pressure to figure out how to resolve this. And we are hearing from some Republicans, Marjorie Taylor Greene, Josh Hawley, are talking about how they need to figure out a way to deal with this.
Hawley, I understand, because he also was talking about, was it Medicaid? Remember when he was out there on that point? Is Greene a new entrant into this?
An interesting voice in this that shows that this is a complicated issue that hits a lot of people's constituents and districts. And I think, and then also we've heard from people like Susan Collins saying, who is a sort of reliable presence in bipartisan negotiations. So the ball hasn't, sort of fully moved, but there are some quiet things happening, I think.
All right. So I want to talk to you, Charlie, because you've been through the shutdown wars of a different vintage, let's just say. What's different about this one, though?
Well, what's different about this one is that I feel like compared to 2013, everything is the same, except the roles have all reversed. Back then, it was the Republicans who were making demands on defunding Obamacare, and the Democrats were arguing for a clean CR. And now, here it is, the Democrats are making demands on health care. I'm not here judging whether they're good or bad demands, but they're making demands, and the Republicans are arguing for a clean CR. It is completely flipped.
Yeah.
They flipped the script. But to the point of these Obamacare subsidies, I think that everybody kind of acknowledges there's going to need to be an agreement.
Yes,
not
and just to give people some
shutdown.
context for this, because Greene herself, the congresswoman, was pointing to the Nonpartisan Health Policy Research Group, KFF, and because they were projecting that subsidized Obamacare enrollees, so if you get your insurance through Obamacare, you could see your premium skyrocket 114%, which is, I honestly had to look at this twice. So that means on average, a 60-year-old couple making $85,000 would suddenly have to pay more than $22,000 more in premiums on average next year.
Yeah, these are the enhanced premiums that are
But this is the context for this battle.
So I think what's going to happen, that the fact that you have representatives like Jen Kiggans from a swing district arguing for this. That wasn't surprising, maybe Susan Collins. But what is surprising that Marjorie Taylor Greene is arguing for this, which I think will actually be helpful in terms of finding an agreement. But you're not going to get the agreement, though, in the middle of this shutdown. I think it's going to happen. Republicans know they're vulnerable, particularly since the changes that just occurred to Medicaid mean many people are going to be losing their coverage.
Yeah.
When you throw these premium increases on folks, Republicans know that health care will be a big issue in the midterms.
But I think, Antoine, you have some insight into this, right? What are you hearing from Democrats? Is this is where we make a stand because we know this is what our voters want? Like, what's the thinking at this point?
Well, part of this truth decay has become a large component of this conversation. This conversation and this disagreement is not about illegals receiving health care or illegal immigrants because you have to have a social security number in order to qualify for the ACA subsidies. What Republicans are conflating is Ronald Reagan's law that says if you go to a hospital, you have to be seen by law. Republicans have not rolled back that clause. But let me tell you what this is about. 18.2 million Americans in red states receive those ACA subsidies, 5.8 in blue states. 76% of those who receive those subsidies are in places where Trump won.
But are you excited to see someone like the Congresswoman speak up? Meaning, does that create cracks in a facade that Republicans are trying to
Well,
maintain?
I brought up those numbers because it proves that this is a bipartisan, nonpartisan conversation. And if you are a working class American in this country paying $350 to $450 a month for your ACA, that's going to go up to about $1,500 to $1,800 a month. So this idea that Republicans have been intentional about defunding healthcare and deprioritizing healthcare is an argument that I think Democrats should continue to elevate. Why? Because it will come back to haunt Republicans in the midterms.
It sounds like it is. Do you get the sense public sentiment is shifting in the attempt to say who owns this?
The shutdown?
Yeah.
Well, yeah, ordinarily the party making the policy demand typically gets blamed. However, in this era of Trump, with the president himself saying a lot of good can happen in a shutdown, Russ Vought threatening to run wild and massively lay off federal employees, this could boomerang back on Republicans. But I don't think anybody really wins this thing. I don't think a shutdown will have an impact on the midterms.